Right, looks like everyone is in. Welcome, everyone. Good evening, Germany. Good morning, West Coast, and welcome everyone in between. Before we get started, we would kindly ask you to follow some guidelines to make this online experience enjoyable for everyone. Please stay muted when other people are speaking to avoid background noise. And please, if you can, keep your camera on, because it's nice to connect a face to our participants and to actually see you. If you'd like to ask a question, please type it in the chat box in the bottom of the page and make sure to send it to everyone and not privately to the speaker, because in the background, we will be organizing these questions and will feed them to the presenter. At the end of the panel discussion, there will be an optional networking opportunity where we will offer breakout rooms with 4 to 5 people each after the meeting then, and you will have the opportunity to connect to other attendees. And the rooms will be assigned randomly. Just a little bit about GABA. GABA, the German American Business Association, is an alliance of corporations, organizations, and professionals with the purpose of strengthening transatlantic business. GABA is a nonprofit organization promoting business between California and Germany that is only funded by membership and event fees. And we usually offer a lot of panel discussions and networking events in person. Since this is not possible at the moment, we are currently presenting online events because we want to stay in touch with our community and give our GABA members the opportunity to stay connected and exchange their ideas. I also want to say that we really appreciate the continuous support from our members at this difficult time. At this point, I would like to thank Fraunhofer Institute for sponsoring the event and jointly organizing the speakers for today's discussion. Fraunhofer is currently leading the initiative InnoHealth USA, and I would like to introduce you to Rebecca Freitag-Lee from Fraunhofer Institute to tell us a little bit more about this project.
Thank you very much, Michaela. Yeah, my name is Rebecca Freitag-Lee. I'm working at Fraunhofer and I'm leading the campaign InnoHealth USA 2021 as part of the initiative Research in Germany. And we partnered with GABA today to bring you this experts panel. So who's Fraunhofer? Fraunhofer is Europe's largest applied research organization with 74 different research institutes in Germany alone and 5 research centers in the US. And who is Research in Germany? Well, Research in Germany is an initiative of the Federal Ministry of Education and Research of Germany. This initiative aims at promoting international cooperation and product design in critical and trend-setting industries. And one of these industries is digital healthcare. And that is why our campaign, InnoHealth USA 2021, is focusing on digital diagnostics and smart sensors. And right now, we are looking for innovative companies, research teams, and technical innovations here in Germany who want to drive the progress in these fields together with partners in the US. And next year in June, we are planning to come to the US, present our innovations, and meet partners on the East and West Coast to drive the progress, hopefully in person, at least virtually. And why are we here today? Well, we want to kick off our campaign with this experts panel on aging with technology, because remote healthcare and especially remote nursing care are huge challenges in aging societies like Germany and the US. And they are also major fields of application for digital diagnostics and smart sensors. So I'm very thankful that we were able to gather such high-class expertise here today to discuss the topic. And I'm looking forward to a mind-opening discussion led by our esteemed moderator, Ms. Chris Rebio.
Great, thank you so very much. Hi, and welcome to you all in whatever time zone you find yourself. So this panel is focused on aging with technology. Our goal is to give you an update about new technologies already in place for older adults. We're going to give you a look into the future, into what is possible and needed, as well as we're going to take a dive into some of the challenges and opportunities for those of you involved in this field. As Rebecca said, we want to foster new collaborations. So why do we care about aging? Well, it's because the populations in both Germany and the United States are growing older. We used to have a population pyramid with many young people at the bottom, with fewer older people at the top. But what's happening, that pyramid has changed into a tree where older people are beginning to dominate the landscape. In 2060, 1 in 3 people in Germany will likely be over 65 years of age. During that same year, almost 1 in 4 people will be over 65 in the US, with the ranks of those over the age of 80 rapidly growing in both countries. So our first panelist is going to set the stage for us. He's going to talk about the aging process and efforts to turn aging into good news, as we all have an opportunity to live better longer. Dr. Eric Verden is the president and CEO of the Buck Institute for Research on Aging, located here in Northern California. Dr. Verden leads a team of scientists who are focused on understanding the link between aging and chronic disease. Eric is a native of Belgium, where he got his MD from the University of Liège and additional clinical and research training at Harvard Medical School. He has held faculty positions at the University of Brussels, the National Institutes of Health, and the Gladstone Institutes in San Francisco. He also happens to be my boss. So Eric, get us started. Talk about aging and the aging process and how technology could be instrumental in helping all of us live better longer.
Thank you, Chris, and good morning and good afternoon to all of you. I want to start by thanking the organizers of this event for the opportunity to speak to you today. We live in very exciting times from the standpoint of aging, and I've compared this to a perfect storm where we have not only a rapidly aging population, both in the US and Germany and Japan and most of the Western world, but we also have at the same time a number of discoveries that are really dramatically changing the way we think about aging. So if we think about where we were about 20 to 30 years ago, aging as a biological process was viewed as an irreversible process against which we basically could not do much. And this has changed dramatically in the last 25 to 30 years. We now, because of work conducted at the Buck Institute, but also in many places in Europe and in the US, we have a dramatically altered view of aging. In fact, aging is a lot more malleable than we used to think. We can, in the laboratory setting, change the rate at which animals age. We can make them live significantly longer. In small animals, sometimes up to 10 times. In larger animals or animals that are closer to us, up to 2 times. So there's a lot of optimism in terms of what aging means and how we might be able to alter it. Now, why is this important? I want to sort of dispel the notion that we are actually seeking immortality or seeking a 1,000-year-old lifespan. This is not what we're working on. The reason is, it turns out that aging is the major risk factor for a whole series of diseases. And you know these diseases, you're familiar with them, maybe yourself or your parents have suffered from that. This is type 2 diabetes. This is atherosclerosis, which leads to heart attacks and stroke. This is neurodegeneration, Alzheimer's disease or Parkinson's, macular degeneration, glaucoma, osteoarthritis leading to hip fractures, deafness. These are a series of diseases for which the major risk factor is aging. When I went to medical school close to 40 years ago now, I was told that there were manageable risk factors and risk factors that you could not do anything about. And aging was one of those. It was accepted that aging, it was one of these things that you just could not do anything about. And our science really indicates that not only aging is malleable, but we have identified a series of knobs, control centers that allow us to modulate the rate of aging. Now, the promise of this is not to make us live to 150 years old. I do not think it is either desirable or possible, but it is to make us live healthier. It turns out that most of us spend close to 15% of our lives afflicted by these chronic diseases of aging. But there's an exception to this, and these are the centenarians. Centenarians not only live longer, but they spend a much smaller fraction of their lives afflicted by these diseases. Now, why am I telling you all this? The reason I'm excited to be here today is we have reached a key turning point where all of this science is now going to be introduced into humans and tested in humans. And one of the key things that we need, obviously, we're not going to be studying, conducting 30 or 40 or 50-year-old studies. We are going to need biomarkers, markers that allow us to determine the trajectory on which each of us are. It turns out that centenarians look younger throughout their whole lives. And people who end up being sick early in their 60s actually have markers that we can identify way earlier. And I believe that technology is going to be an incredibly important tool for us to monitor people, not only in their old age, but also throughout their lives. And the goal of this is to essentially predict who is on a bad trajectory in terms of lifespan and health span, and to be able to recommend interventions. As the population age, we can expect the fraction of people to be afflicted by the conditions that I described earlier to be larger and larger. Therefore, there's an incredible imperative to understand, identify those people most at risk, and to provide interventions, drugs, or lifestyle factors. So I'm excited to be here, and I look forward to the rest of the conversation.
That's great. Thanks so much, Eric. So next up, you're going to hear from someone who is responsible for delivering care to German elders. Ulrich Lilia is president of Diakonie Deutschland. It is the social welfare organization of the Protestant Church in Germany. It is comprised of charities and organizations that reach more than 10 million people at all stages of life. Services for older adults focus on housing, assisted living facilities, home care, recreation, and education and support for caregivers, among others. Mr. Lilia is a pastor. He studied theology at the universities of Bonn, Göttingen, and Hamburg. So Pastor Lilia, there's lots of ground to cover in 5 minutes. In a previous conversation, you told me that self-determination is a guiding principle of Diakonie. So what does that look like in your organization? What are the challenges and opportunities? And how does technology factor into all of this?
Yeah, thank you, Chris. Good evening, good morning, everybody. Nice to see you. I'm very interested in this discussion. Ladies and gentlemen, there has been considerable progress in the development of care technology in recent years. Nursing 4.0 refers to a wide range of new possibilities from ambient assisted living to telecare, telepresence medicine, and robotics. As per a vote of the German Ethics Council, an ethical evaluation of these new technological possibilities should be based upon at least 3 criteria. First, caregiving staff should be effectively supported by technological assistance and their work facilitated. Second, new technologies should help to develop innovations in caregiving, for example, in activating care or rehabilitative care. Third, technological systems must not replace human interaction in care. The crucial issue is how the well-being of people depend on care or assistance can be improved. In 2017, more than 3,400,000 people in Germany were in need of care as defined by the Long-Term Care Insurance Act. 3/4 of these were cared for at home and 1/4 in patient geriatric care facilities. In contrast to Scandinavia, where the state is primarily responsible for care and the organization of care, the German social system is based upon a familial approach. Care recipients, or as the case may be, their families receive an allowance for home care. There are about more than 1,150,000 people employed in the caregiving sector, and well over 4 million relatives providing care. Experts note a divergent gap in caregiving in light of the demographic shifts in the ever-aging German population. That is, more and more people in need of caregiving in contrast with less and less staff. In view of this shortage, which is already apparent and worsening today, hopes are being pinned on new technological developments. It's conceivable, for example, that the burden in patient facilities could be eased by enabling older people to live independently in their familiar home environment for longer periods of time, thanks to service robots. However, we must not permit such technological possibilities to result in less social or emotional contact, nor may we permit technology to infantilize patients or restrict their privacy or freedom of action. There are an estimated 150,000 or maybe 300,000 very poorly paid Eastern European caregivers in German households, and pay in the caregiving field remains highly unequal. Consequently, there are fears that the financing of technological assistance systems should hinder necessary improvements in the personal sector, e.g. a better patient to caregiver ratio, better nationwide remuneration, or an improvement in the image of caregiving. Nevertheless, the majority of the population has a positive attitude towards technically advanced and useful robotics in caregiving, as significant surveys show. For example, 3/4 support the use of robotics as a reminder to take medicine, food, or drink, while 65% support the use of robotics for falls or as a means of getting up. There is also a high level of approval among professional caregivers for assistance in physically challenging caregiving activities. Overall, when using robotics or techniques, it must be taken into account that long-term caregiving in particular frequently involves particularly vulnerable people who are physically, cognitively, or emotionally at risk and are often unable to articulate their own needs. Thank you for your time.
Great, thank you so much. So next up is Dr. Andreas Hamper. He is from the Fraunhofer Institute for Integrated Circuits, where he does research in IT services for healthcare and healthcare delivery. He focuses on user-centered design, smart homes, and ambient assisted living. He received his PhD in information services from the University of Erlangen-Nuremberg. Dr. Hamper is working in rural areas of Germany. He is an engineer who wants to make sure his technology works for people, including both older adults and those who help care for him. So Dr. Hamper, what are the challenges and opportunities? How do you do what you do?
Thank you, Chris. I'm really excited to hear from all of you today and exchange some thoughts on this really, really interesting topic. I might bring to the table some insights from our research projects we do in areas in Germany that kind of face challenges that are very, very typical for many countries with rural areas, and for the challenges in the healthcare system. We have a major research project where we want to work with some rural areas in Bavaria, and to improve the healthcare delivery processes and the connection between three players: the home environment, the family doctors, and the ambulatory care. So outpatient care is a very, very stressful job, and it's really demanding. And we see, when we look at demographic changes, that we have a high number of people that will need outpatient care in the future. For example, we did some studies in our research areas, and we can show that by 2030, every third person in the rural area of Kronach will need assistance in their home. And if we ask the people what they really want, they want to stay at home as long as possible. And this is our major goal, to bring technology to the people and help them. And that's what ambient assisted living really means. We want to bring technology to the people that they can handle their daily life and also their diseases and their care process better, supported by technology. And if we take these areas and look at the people that are living there, we mostly we see three challenges or three demands that these people want. They want to stay safe. So in case there is an emergency, you want to be sure that there's someone there that helps you, and there must be technology to inform some caregiver or a relative. Second, you need assistance in the activities of your daily living. You need help sometimes to handle heavy objects, to take care of your activities of daily living, or just to manage your home in the way that you can do it in the way that you did the last 40 years or 50 years in this case. And third, and most important, we need technology to communicate. And we do not mean instant messaging by that. It's really important to be connected to your relatives, but it's more than just sending text messages. It's communication on the professional level, depending on your healthcare status and your diseases, with your outpatient care and your caregivers, but also your relatives that many times take care and support you and kind of, check in, how are you doing? And on the other side, in the professional healthcare system, doctors and family doctors see their patients when they live at home, usually 2 or 3 times a month. So, and in many cases, it's routine data that is collected. So relatively simple measurements that are taken at the doctor's office. And it's more about communication, about checking in, how are you doing, how's the patient doing, and to detect differences and trends and the overall status, not just one value, on a more detailed level. And that brings us to where can we bring technology to the table to support these needs and these demands. And we try this on 3 levels. We have with real houses where people live in the area of Kronach in Germany. We equipped houses with ambient assisted living technology. That's what you call it right now, or you called it the last years. I think it's more and more mixing with other smart technologies like smart home. So we bring assistive technology from the smart home and ambient assisted environment to the homes. We bring variables, consumer-centric and consumer-grade variables to older people. That means step counting, smartphones, smart health devices to measure your blood levels, to measure your weight and stuff. And also we try to bring medical grade technology to the user himself. And this is technology that was used or is used by medical professionals. And we try to extend the arm of the doctor so that the doctor can operate and instruct the patient to do simple measurements like blood pressure monitoring at home on a medical grade. So that must be under very, very close communication between doctor and patients. And I think when we have this data connected, it's important not to just look at single individual solutions, like one data point for one use case, but to use the power of a strong database and a strong number of attributes we know about the people, that they get to know their situation better, they can take care for themselves better if they have more data. And in the end, we help people to stay at home safe, but also get the help they need from technology, either technology mediated or also supported or delivered by technology.
Great, thank you so much. That's great. So I want to remind everybody that if you have questions for any of our panelists, you don't have to wait to ask them. You can put them in the chat box and we'll get to as many of them as we can. Our next speaker is Dr. Mandy Salomon. She is an entrepreneur working at the intersection of creative media, human-computer interaction, and cultural gerontology. She is building next generation tools for people living with dementia and those who support them. She is the co-founder and CEO of Mentia, which she brought to the US in 2017, where it is a portfolio company at Launchpad Digital Health in San Francisco. Dr. Salomon received her PhD at the Swinburne University of Technology in Melbourne, Australia, for her work on inclusive design for people with dementia and for developing digital systems that enable them to participate in life. Her work has been described as supporting digital empathy. So Mandy, your app is called Diva World. Can you tell us how it's being used?
Thank you very much, Chris. Hi, everyone. Are you able to hear me sufficiently? Good. So Diva World, there is behind me, my background is, my virtual background is a still from the world itself. The idea, we're in fact a communication tool. We look at helping people who have neurodegenerative diseases and have trouble expressing themselves. So we assist them by providing them with an interactive world which they are able to navigate, and we embed it with stimuli, engagement stimuli, that is based on their lived experiences. So you can see in the house, we have a piano, we have music and a record player, books in the library. There are stairs that lead up to a bedroom, and there's doors that lead out into a garden. You can change the environment. From a philosophical perspective, we take the position that every object holds multiple meanings for people. And so when a person with, say, dementia is working through this game world with a supporter, typically a caregiver, but it could be professional or a family caregiver, volunteer, friend, that person assists them to navigate through the world just through touch. And so touch is simply a matter of someone independently touching on objects or with the assistance of the other person tapping on objects. And this acts as a cognitive scaffold for engagement. Now, it can be non-verbal engagement, but it can also be obviously verbal engagement, and then the objects become triggers for stories, incidents, experiences. It's more than just reminiscence. It's about bringing people's digital lives into an environment where they can manipulate them. If we think of ourselves, we may be subscribers to YouTube or Facebook or Instagram. We have a life that goes beyond our physical lives, increasingly digital lives. And it's a matter of human right to allow people to continue their digital life once they are older and may develop cognitive disabilities. So in our world, what we do through a dashboard is upload digital objects which are meaningful to the player. That could be in the form of photographs, it could be videos, it could be video messages which are easily accessed through the television inside the home. It could be music, obviously. There are lots of elements in the world that allow people to upload or have uploaded on their behalf their digital artifacts to help them amplify the sense of self, which is diminished by their illness. And at the essence, expressing sense of self is a quintessential human element. And when that is suppressed through disease, for example, people's response to their disease is more negative than it need be. So they can have behavioral responses such as depression and agitation, mood disorders, all the things that we know engagement stimuli in the actual world supports, we build into what we call Diva world, which is our world. And this is, as Ulrich was saying, tech systems must not replace human energy. So we see this as a way of communicating between care partners. And also, because it's a digital system and it's serviced through a dashboard where a lot of customization happens, we're also linking providers into this, these sessions. They can see what is happening, caregivers can give back instant feedback, families can get involved by checking on what their loved ones are doing. And so we're also very concentrated on information flow and using the system to link not just the dyad, but what we call the triad, where the provider is also involved. And that has its own cascading effects around health economics and provision of more efficient systems and services, and also educates staff at the same time because they're learning more about their person, and they're also increasing their skills because they're learning by doing, by playing inside the world. Thank you.
Thank you very much. That's great. So now we're going to zoom out to get a larger perspective on what's happening with healthcare and technology in Germany and beyond. I'm pleased to introduce Professor Thomas Schildhauer, who for the last 8 years has been one of the executive research directors at the Alexander von Humboldt Institute for Internet and Society, where he's responsible for research focused on internet-based innovation and for the Innovation, Entrepreneurship, and Society Research Group. Dr. Schildhauer is founder and director of the Institute of Electronic Business, the first affiliated institute of the University of Arts in Berlin that was established in 1999. He studied computer science at the Technical University in Berlin and holds PhDs in the field of software, marketing, information management, and public health. He's also done research at the Massachusetts Institute of Technology here in the US and at the Edith Cowan University in Perth, Australia. He looks at the interface of data and society, takes a user-centered approach to technology. Dr. Schildhauer, please give us your take on the challenges and opportunities in this field.
Yeah, thank you very much. And it's a pleasure to be here. And so I would like to introduce to you the Digital Urban Health and Aging Center. We are just setting up the research center project unifying academic disciplines and industries, markets, countries, and civil society. So the question is, what idea is behind this initiative? And so let's imagine together that life, health, and aging are considered as an integrated whole. Smart health systems are developed through collaborative industrial and sectoral innovation. We will have in future preventive health that takes place on site. And as Mr. Lilliot told us, that we have the caretakers who would like to have that technology underlying services at hand and on place, on site. So we would like to have that in our world, what all we could have on the technical side. So the care environment becomes more appealing, more effective, more motivating, and by means of data-driven diagnostics, human-centered robots, and greater patient focus. So we would have more time to have the human side on the patient and use the technology to do the work which is not so human-centered. So there might be artificial intelligence, robots, and medical techniques are tried out and compared, and their effects and acceptance researched by our institute. So to help working out to fulfill these opportunities, we founded that Digital Urban Health and Aging Center with the idea that it's interdisciplinary, inter-industrial, and intersectoral innovation for healthy cities, healthy districts, and healthy people. So aged care will become a more prominent feature of the economic. Oh, sorry. The iPhone is just jumping up.
That's your robot.
It's a supporting system too. And so aged care will become a more prominent feature of the economic landscape, but government will be looking for ways to finance these cohorts by enabling senior citizens to remain at home. So as Andreas told us, stay at home for longer in the environment where the people lived for years and years. That would be one goal, to help them based on technology. That's also our idea. So it will be cared and cost-effective care providers and participate as much as possible in a meaningful life. So just imagine that technology vendors and startups are releasing and increasing areas of products that offer great promise in this area. These products monitor health and well-being and can counter loneliness, increasing cognitive impairment and isolation. Digital solutions, from our point of view, can also assist dealing with government agencies, care organizations, and other access to other things. So care robots and other companions, personal digital assistants, ambient smart homes, or as you said, ambient assisted living devices, a huge variety of medical and care devices and multi-sided platforms are becoming available. So the Center for Digital Urban Health and Aging adopts a learning district focus. So we would like to have a kind of a living lab approach focused on community action research and service learning. So as the example from Andreas, we would like to go into the cities, into the districts, into the quarters, and try to find out what helps the people. And so we would like to do this we do this from research perspectives, from design, from layout perspective, ethnographics. We have researchers from the sociological research area, from medical technology and computer science. And one main part is the area how to handle the data. So we will have experts, research experts handling with data protection regulation, data governance theory, and as Mr. Lear said, self-determination is also one main topic from our side to help them to be self-determinated. And the interdisciplinary and ecosystemic business, economic, and multi-sided platform orientation is our core. So the scientific and practical insights leads to prototypes from our point of view with comparative accompanying user-centered research. And this is accomplished by research experts from our Humboldt Institute, the Einstein Center of Digital Future in Berlin, the German Internet Institute, and of course, US colleagues, for example, from the US Berkeley University of California. So we are just, our next steps is that we develop their intersectoral do a foundation forum for innovations in the healthcare systems further as a space for open exchange on issues between commercial sectors, markets, civil society, and state actors and scientific disciplines, which I mentioned. So in 2021, the concept will be validated, supplemented by the participants, the companies, the organizations, the researchers, and of course, from a human-centered research approach as a center for the digital urban health and aging. Thank you.
Great. Now it is time for a conversation among the panelists. And once again, if you have questions, please enter them in the chat box. The first thing I want to address is sort of the elephant in the room. It's one of the reasons why we're visiting with each other digitally. So COVID-19, can our panelists talk about the impact of the pandemic on the use of digital technology? Is there a bit of a silver lining inside the pandemic? What do our experts have to say about the impact of COVID-19? Oh, Mandy, you need to unmute yourself. There you go. Okay.
I might chip in first, if that's okay, because we are a tablet solution. A lot of people think virtual world, virtual reality glasses. No, our world is an immersive space where people understand the time and space of the world that we've developed, but it is a tablet application. Because it's a communication tool, we need to have the full range of people's expressions and co-location so that they can communicate beyond the application itself. And of course, we were very surprised to see how few people in aged care had tablets in their organization or had reliable Wi-Fi. I'm talking about the US because I have a knowledge of Australia too, which is not quite the same scenario. In the US, staff were not trusted with tablets, especially in home care organizations. And generally, there was just no use of tablet in any systemic way. But now with COVID and telehealth, it's now becoming, it's fast-tracked, which is great for us because that was a real litmus test. If people weren't prepared to use the device, then all the applications, clever applications in the world didn't make a difference. Now, having said that, we're also able to address the isolation that people feel by being actually separated from loved ones when they're in residential care through COVID. And they're also not able to go to group activities as they normally would. So once again, having a communication tool or any tablet is now seen increasingly as a critical tool. And that's changed.
That's great. So Dr. Lilia, I saw you shaking
Yes.
your head. Is there are elders under your care? Are they more open to technology because of what's happened with COVID-19?
Yes, I think they are, Chris, because we have had here a big discussion in Germany about the right balance between participation and shelter, especially in elderly care homes. There was a big discussion because they were closed for 2 or 3 months in Germany, because everybody said, okay, this virus we have to defend. So there are no visits allowed, no relatives, and the people were very isolated. So they create a lot of new creative solutions. Some of them, they create new coordinators who coordinate the visits of relatives, maybe on tablets. They assist the visitors and said, okay, let's talk to your son, and they create it and they assist the elderly people. So I think there's a push in this development, and a lot of elderly people are able to use a tablet or things like that. The other one, they need assist, but I think there is a push to create new technical solutions. And now we have a very difficult situation again in Germany. I think numbers are going up, and we will we have to prepare that we come not in a complete isolation too, especially for elderly people. I think it's very terrible, so I think there could be a good new use of technology solutions.
That's great. So I want our panelists to focus on personal digital health information. That was exploding before COVID-19. You know, everybody has their widgets, everybody's keeping track. I know, Dr. Hamper, you and I talked earlier about the possibilities for this, and I also want Eric to talk about the possible use of digital technology to help us track how we age. But let's start off with you first, Andreas. What can you say about the explosion of Fitbits and other sorts of technology?
Yeah, thank you, Chris. I think we all started with these Fitbits and wearables years ago, and we thought it's okay, it's a gadget. We want to measure ourselves better. We want to track ourselves. But the more the technology evolves and gets better, the more we find use cases that really have an impact on our health. And I think this is important also for elderly people when they get in contact with digital technology. And that's what happened during COVID. Sometimes they had the chance and also the need to use digital technology. For example, we equipped the households with iPads. First, the idea was last year to track blood levels and all the things you can monitor with your wearables and with your healthcare. What our patients did in the last 6 months, they started to do video calls with the iPads. Yeah, so they saw pictures of their grandchildren, and that's where they saw a real benefit from digital technology. And the good thing is, when you have them, you can explain the benefits with healthcare technology, with wearables, with new devices. They are open-minded when they see the real benefit. And that's what happened when they did their first video calls and get the pictures from their grandchildren. Then they started using, hey, what else can I do with this thing? And I think that gave a big push, a forced push, but a push to, okay, we just try it. And then we see the real benefits. And also it means it shows us that it was really difficult to communicate the benefits that elderly people can have from digital technology. They have to just see it with their own eyes and experience it. It was really difficult to communicate it in the last years.
Got it. So Eric, talk to us about personal digital information and how that might factor in as far as helping us age as well as possible.
Yeah, maybe I'll first speak a little more about COVID because I think it really has, as a society disrupting event, is really brought to the fore the potential of digital technology. And I will give you two examples. One is one of the aims and the consequence of digital technology is our ability to keep people at home longer versus the nursing home. And in this, by monitoring them and by identifying the people who actually need service. One of the things we've learned from COVID-19 is that one of the worst places that you can be today is in a nursing home in terms of survival of COVID-19, because the virus tends to spread very rapidly in a vulnerable population. So it turns out that individuals who are at home are doing much better. They have much less exposure. So that's one aspect. So the technology has incredible potential for monitoring people at home and allowing them to stay in their home for a longer period of time. The second aspect is identifying people who actually need to go to the hospital. And this is technology that has not been realized, but it's really coming to the front. One of the characteristics of COVID-19 infection is the fact that patients can become hypoxemic with a very low oxygen in their blood and still look relatively happy. And so in the early days of the epidemic, a lot of people died because they went to the hospital way too late. And so an example of technology that is available today, and that could be deployed for people who are infected and decide to stay at home, is measuring oxygen saturation. This is really mainstream technology. It's can be linked to an iPhone and can be monitored by a doctor. So these are for me, two really good examples of how technology in the future could help us with an issue like COVID-19.
Great, thanks. So I have a couple related questions. This one first is for you, Mandy. If every virtual world is built individually for each patient on your app, you need a lot of input from family members. Do you see an effect that this triggers more communication within families? And I also want you to address caregivers because I have a question about caregivers coming up. So Mandy.
Yes, well, the world is a metaphor for one's home. It's not one's actual home. Although we are hoping to make we have different languages. We currently have it in French, we have it in German, in Greek. We'd love to have it in German. But the content itself, a kitchen in an Indian home may look different to a kitchen in an American home. So because it's a virtual world, we can create multiple environments. But we like to do that with a partner, who wants to help us to actually, the economics around building that environment. But once we have the shell of the home, it's then the artifacts inside the home are then populated by the family. So yes, if someone is in an early stage of, say, mild cognitive impairment, they can do this themselves or with the help of someone else to choose from their artifacts, from their pool of artifacts, what they want to come into the world. And then it becomes a sort of repository for them as they move further down the dementia journey, along their dementia journey. But specifically families, yes. If this does bring families who are remote, either because they're not allowed into someone's residential care environment because of COVID, or because they just don't live anywhere nearby, they can be the ones that help curate this content. They simply upload it on the dashboard, and then through our back office positions it contextually inside the world. So it is a wonderful way for them to contribute to their loved one's care. I think of it as if, I know my grandmother and I have a very special relationship with her, but currently I'm a body walking around not sharing that with anyone. With Diva World, I can actually enhance my grandmother's care by allowing the information that I contain about her to go into her world. And this is a very powerful thing. It does, but then on the other hand, you also have families who can sit next to each other and play together. So it's a very rich way of building stories, understanding, learning about the other person's lived experience. And so, yes, it is a multifactorial in the way that we involve families. And of course, intergenerational activity comes into that as well.
That's great. So the other question that we had was about, besides all the technical possibilities that are great and there are more to come, taking family members, staff with you is an important factor as well. So can anybody talk about working with caregivers? Training didactics, methodologies that are helping bring everybody into the space of dealing with the needs of older patients and their caregivers. Dr. Lilia, how about you? Do you have any? What's the situation with, I guess, caregiver?
I don't get your question acoustic.
Okay. So I'm asking about caregivers specifically, yes, and technology. And yeah, are there efforts to bring them into the system with education so that they can be better equipped to care for their patients? Or Mandy, I know you had talked when we had talked earlier about it, your app fosters a better relationship, yeah, between caregivers and patients. So do either of you want to jump in on that?
Yeah, I could imagine that. I don't know really if such assistance systems do exist. Yes, and I don't know that. But I could imagine that could be created an app to make a better communication, to become a better surrounding. I think this is a very good idea and possible if caregivers go to the homes of people. They have diagnostic questions, and they always they ask what's about your heart, what's about your drinking. They have only medical questions, yes, and the social aspects of living. They're so important, but they are not. They are not in the horizon of those people, and if you could train that by such application, I think that could be a very good way.
So before I get to you, Mandy, I thought I saw Dr. Schulhauder. Did you raise your hand? Do you have something to say about including caregivers in the whole technology world?
Yes, so I could give some information about one research project we have had about the question, how could you give kind of learning bits to caregivers according to the environment and the installation they have when they go into a room or into a flat where patients are. So they could get learning bits for that situation, for the technical installation they find out, and get some additional information how to handle it. So that would be an adaptive way to give that learning information. It would be situative. So according to the situation they find out, they will come into, and it could be individual. Of course, any person has different skill levels, so they could definitely get the right information and learning information they already need in this situation.
So Mandy, with your DivaWorld app, what's been the impact on caregivers and their relationships with patients?
Yes, there's much research that shows that the more caregivers know about their person, and the better care they can deliver. So the things that, there are many frustrations when someone with dementia is expected to live in the world around them, and there's a lot of reason to help caregivers to understand where that person is at, so that they enter the person's world rather than the person trying to do their best in the actual in the world that the caregivers inhabit. So having a world like DivaWorld means that the caregiver can, in fact, sort of step into their participants' worlds, their clients' world, and learn about them. And this has effects beyond the application itself, because they're able to bring that knowledge to their everyday care. The way we look at it is Maslow's pyramid. You have custodial care or everyday care at the lower part of the pyramid. It's all about feeding, dressing. When I say feeding, I really mean preparing meals, eating, dressing, and self-care, etc. Medications. These are all the things that happen in the lower part of the period, but the upper part of the period of the pyramid of self-esteem and the sense of belonging and self-actualization, they get left behind all the time because of the daily tasks are so onerous and must be completed. Well, with DivaWorld, the care partner and the care recipient meet at this higher level of the pyramid, and then that has an impact on the everyday activities that are being done. And that's the theory. And we find that happens, that is in fact playing out in our studies and early adopter communities.
Great. So we have a big question from somebody in the audience. I was going to tackle this. So in the US, there is growing awareness of how corporations are using our personal data to influence our lives. There may be mounting reasons to push back on technology. In Europe, there are more protective laws against such usage. Are people more comfortable with using technology in Germany because you're more protected? Or are people still very cautious about access to information? So Dr. Schulthauer, I'm thinking that maybe you'd be the guy to tackle this question. What's the issue with privacy in your country?
So one point is that, of course, we have that rules about the GDPR, but what we are working on is more the way of giving the people the self-determination to have the chance to understand what could help them if they give data to researchers or to an organization. So that's one point we are definitely working on very hard from the design approach, for example, with special design patterns, with design icons to help people to show them very easily where data are collected and where they could help if they donate their data and give them to researchers or organizations. So we try to lower that hindering factors which we might have at some areas. So we try to support people and researchers to give their idea of please donate data and giving them for good reasons. And of course, we also talk about trust holders, trust center, which take care that the data are not used for something which was not intended. So that's the way we are just doing, from my point of view, we are in research in that area.
So Dr. Hamper, how about, what's your experience out in the field? Are people relaxed with technology and as far as its impact on privacy in their lives?
I think in general in Germany, people are concerned to keep their data private. It's a topic that you do not want to share your data, as Thomas Schildhauer said, and you have to show the possibilities that can be leveraged if you share data. But I think data is always, it's dual use. You can do good things with data aggregation and data analytics, but you can also use them for purposes you did not want to or you did not agree to. And I think you have to show both sides and enable people to understand better what is the value chain, what can happen with my data. And then I need some control over it, that I can steer in which direction my data is used, and also make my own decision. Is it worth to share my data, to get several benefits, but be conscious that there are risks and that you have to check that your data is used only for these information. Let me give an example. We all talk about smart metering and smart homes. That's really great. We can build better grids. We can get cheaper power prices. But if I know how much power you consume during the day when you live at home, switching on your coffee maker, switching on your lights, I can get a very precise profile what you do at home. So it's dual use. You can use it to improve the world and create real benefit, but you can also do things that are not really clear and visible and sometimes not intended by the user.
Got it. So thank you very much. So I'm looking at my clock here. We have come to the end of the time for the formal panel. So I'm going to kick it back to Carolyn. She's going to talk about the networking groups. I have so enjoyed being with you. I'm going to hang out a little bit. If there's a desire to continue the conversation, I'm happy to do that too. I enjoy hearing people. I see people nodding their heads with what we're talking about. So thank you for being here. I have enjoyed being here. And Carolyn, it's now back to you.
Yeah, I'm taking that over. Thank you so much, Chris, and thank you to all the speakers for this hugely informative session. Now we would come to the networking part of the session. How we usually do it is that we randomly put this group into different smaller breakout rooms of 4 to 5 people.